Good afternoon, everyone. My name is Jeff Cooper, Health Commissioner at Public Health Dayton, Montgomery County. Thank you for being here today. Welcome to Public Health. It's been a while since we've had a news conference, and we're excited to be back here today to provide you an update, especially in light of the information that we shared at Governor DeWine's news conference today. We're also pleased to have Mayor Nan Whaley here again, and I believe Sarah Hackenbrack from the Greater Dayton Area Hospital Association is on her way. So I think it's important for us to just kind of pause to reflect for a moment. Think about it, in the short span of about 4 months, this COVID-19 pandemic has drastically changed our way of life. The terms flattening the curve and social distancing, those are terms that historically public health has been aware of. We're all familiar with those now. They're part of our common vernacular. Everyone understands those terms and what we need to do collectively as a society. And if you think back with the first order issued by Governor DeWine on March 12th, prohibit mass gatherings. And then from there, closure of schools, carry out and delivery only for restaurants, non-essential surgeries canceled. March 22nd, the first stay-at-home order, and that was subsequently amended, and then closure of child care centers without a pandemic child care license. So that's a significant disruption and change to our normal way of life, as well as establishing essential and non-essential businesses and operations. So I think it's important that we all understand that there's no perfect answer in all of this. No one has the definitive answer, right? We don't really know the prevalence of this disease because people who are asymptomatic can shed the virus. So we don't really know the disease burden within our community and what the true mortality rate may end up being. We also have a testing shortage, so very few people are currently being tested. So there's still a lot of uncertainty. But we acknowledge that our community has anxiety, frustration, it's an economic burden. How are they going to take care of their families? How are they planning for the future? All of those things are significant challenges that we all face. But at Public Health, what we will do is pledge to give you the most up-to-date, accurate information as we receive it. It may not be the perfect answer, but we're trying earnestly to make sure that we give you credible information. Our governor has outlined the next steps as we move forward as a state and as a community, and it's important that we all adhere to those because we all play a role. So that common message of prevention doesn't go away, and we know the real simple things that we need to continue to do regardless of what happens with businesses and operations. So we wash our hands, we don't touch our face, we cover our coughs and sneezes, we stay home when we're sick, we care for others. We clean and disinfect commonly touched surfaces, and we maintain social distancing, that 6-foot distance. And as we learned today, we wear a face covering for the most part when we're at work and when we're shopping and or other activities in the community. It's strongly recommended that individuals wear a face mask at all time when in the public. So the governor today obviously indicated that the stay-at-home order remains in place, but it will obviously be amended. And we're aware that it's going to be a phased reopening for certain business sectors. And he's doing this in a layered approach. So on May 1, healthcare essentially reopens in terms of non-essential or elective surgeries resuming in the event that the patient does not have an overnight stay, as well as dental services continue if dental facilities are comfortable with reopening. On May 4th, manufacturing, distribution, and construction sector then begins to reopen, and general office environments also on May 4th. And then May 12th, consumer, retail, and services sector. So as we open in a layered approach, it's pretty obvious that the governor will be looking at indicators to make future decisions. So what's our testing capacity as a state? How is public health able to do contact tracing? How are businesses, both essential and non-essential, complying with the amended order and those mandatory requirements? So obviously future decisions then will be made around child care and nail and hair salons and gyms and places of amusement and mass gatherings. Those all continue to stay non-operating as indicated in the current stay-at-home order. So there are protocols that we're all aware of now if you watch the governor's news conference in terms of mandatory requirements for all businesses, all working environments. So require face coverings. At all times, employees and customers wear a face mask at businesses. Conduct daily health assessments of employees, monitor their symptoms, make sure that if they're ill, they go home. Maintain good hygiene, we're all aware of that. Hand washing, continue to stress that. Social distancing, as well as maintaining teleworking options. Even though it's an essential now business that was previously non-essential, even those previously essential businesses, they should continue with virtual meetings and teleworking to the degree possible. Clean and sanitize surfaces, and then, this is a significant one, limit capacity to 50% of the fire code. And so businesses, all businesses now will need to make sure that instead of just determining on their own what a maximum occupancy rate should be, they should be limiting capacity to 50% of the fire code. And then another requirement, and this is very important, work with public health. So in the event that a customer or an employee becomes sick, report that to public health, and then help facilitate public health doing its contact tracing. All of these indicators are going to need to be in place, and all of these requirements we have to adhere to. We have to do this together as a community if we want to move on then to the next phase of a layered reopening. So all of our actions that we can do together in this community are going to help as then the governor needs to make decisions moving forward with the next phase of additional reopening. So there's no doubt in my mind that our community has performed tremendously to date. If you think about it, the information line that we have, the public information that goes out there, the work that citizens are doing, the work that businesses are doing, our healthcare partners, first responders, public health entities, all of us working together to make a difference in our community. And if you take a look at the statewide data on the ODH COVID-19 dashboard, it's pretty clear what this county's been able to accomplish. So thank you to date for everything that you've done as individuals and as organizations, and we'll continue to work together to make sure that Montgomery County continues to be a healthy, safe, and thriving community. And with that, I'd like to welcome Mayor Nan Whaley to the podium.
Oh, well, good afternoon, everyone, and thank you for being here and for watching at home. First, I just want to echo what Commissioner Cooper has said, that what our community and the whole state at large, but particularly our community, has done through this time has been really, really remarkable. And it's because of those reasons that we can make some changes, and the governor is going to make some changes for May 1st as the order ended April 30th. I think the most important thing that needs to be said about this new order is really very little has changed. If anything, there are places where we'll see some strengthening of some rules that I know lots of people have contacted me about. So the stay-at-home order is still in place. So what does that mean? That means if you don't need to go somewhere, don't go. Unless you really, really need that product, stay at home. It also means don't be having big gatherings. We are being successful because of that work of really physically distancing, and we're going to have to continue that work. Now, there are some changes to help open the economy, as Commissioner Cooper said, as we think about manufacturing and distribution in places that are private spaces. And then May 12th with the opening of retail, which most retail, quite frankly, is mostly opened right now as it is, but there will be changes in that as well. And I think these are good changes. You must wear a facial covering by May 12th if you're going to the Kroger, if you're going to a store, and every person that works there should have a covering as well. I think we're getting smarter about this work. We recognize that we need to have chances to open up a bit, but we have to be very thoughtful in it. And really, when on the day-to-day efforts of what you're doing, we want you to still continue to stay home. Take those walks, maintain 6 feet so we can keep our parks open. But we still want, the physical distancing is very, very necessary as we go into this next phase. This is important. This next month and how we behave this next month will determine how we do the following month. We don't want to have to tighten back up on some of these pieces. We want to continue to make sure that we can start even thinking about a bit of economic recovery. But if we do not do these things thoughtfully and don't follow the rules of this order, we won't be able to do that. So that's the message I have today. You know, the stay-at-home order, as difficult as it is for folks, you all have done a great job. We want to continue that, continue moving forward. And as we think about retail in the coming weeks, we are only going to go out unless it's absolutely necessary that we get that product. With that, I'm going to turn it over to the head of GDAHA, Greater Dayton Area Hospital Association, Sarah Hockenbrock.
All right, good afternoon. Thank you very much, Mayor Whaley and Commissioner Cooper. So we did receive some positive news today, and that is positive news for our health and our economy. And as the governor has stated many, many times, the two are inextricably linked, especially here for us in the Dayton region. We depend, as the Daytonians, on a healthy workforce, and our workers rely on that healthy economy for them to have safe, employable jobs to go to every day to bring home a paycheck. And our businesses need the innovative, high-quality, affordable health care that we offer here in the Dayton region, and that includes our region's hospitals. Beginning May 1st, our hospitals will return to some of their normal operations with elective procedures, and they will be procedures that do not require an overnight stay. For those individuals who have been waiting for their procedure to be rescheduled, stay tuned. Your physician, your hospital, or your surgery center will contact you regarding rescheduling your surgery so that you can know exactly what is going to happen and when is going to happen for your procedure. I want to continue to emphasize that our hospitals remain safe. They have been safe and they remain safe. And going to the hospital may be something that is a little different for you. As we have talked about, you may be asked screening questions upon entering the facility. You may have your temperature taken, and you may be given a mask to wear while you are in their facility. Just because these are different ways of operating, please do not delay your emergency care out of fear. Do not delay scheduling your elective surgery or your procedure out of fear. These are all things that we are prepared to take care of and help you with all of the new restrictions and screening questions and requirements that we have put in place as safeguards to protect you, the individuals that we take care of every day, our patients, and to ensure that our healthcare workers are safeguarded against COVID-19 as well. Nearly 35,000 individuals in our Dayton region receive a paycheck from our region's hospitals. So we are looking forward to a return to a new normal operations with our new restrictions as well as the screening questions and wearing masks. But bringing those individuals back into our workforce allows us to ensure that we are here to care for you in our region. We will operate with you under this new normal and continue to look forward to what is in our future, which I think is a very bright future for us in the Dayton region. Thank you.
Thank you, Mayor Whaley, and thank you, Sarah. Are there any questions by anyone? Do I have anyone on the phone?
Commissioner Cooper, it's Danielle Malagary with Fox 45 News. I do have a question. How does the county plan on enforcing these new guidelines to open up the state?
So the question is, how does the county intend to enforce these new guidelines? Obviously, it's pretty clear based on an initial review of what was talked about by the governor today at his news conference, and we'll place those documents on our website. It's pretty clear the requirements, and it's really the requirement of employers to make sure that they're enforcing these requirements. So public health will continue to do its part, but we need to make sure that all citizens and all employers comply with this requirement. So if you're a citizen, it's incumbent upon you to take a face mask with you when you're at a business. And similarly, with businesses that are now operating or continue to operate, it's a requirement for you to make sure that your employers or your employees, as well as customers entering into your store, are wearing a face covering, as well as limiting capacity to 50% of the fire code. And then nothing really changes internally regarding the social distancing requirements. So it's continuing to telework, continue to have virtual meetings, maintain 6-foot distance separation, etc. So the compliance part really doesn't change.
Thank you.
You're welcome.